how else can we prevent people from dying from COVID? And I was seeing the evidence coming out on vitamin D, on weight loss, on all these risk factors that are modifiable, like lowering your blood pressure. All of that reduces your risk of hospitalization and death from COVID, and not a peep from public health. So I'm like, why isn't anybody saying anything?
So in your medical opinion, do you believe that there was more damage done through lockdowns than we did good?
Yeah, I think that's true for sure. Especially in the beginning, with all these lockdowns, they caused a lot of harm. Nobody even talked about them, and it was harm that was put on people against their will. They were forced into these lockdowns. They didn't choose to do that, and so it definitely caused a lot of harm.
Right. And what were a lot of the things that you saw manifest in adults?
Yeah. So on the physical level, it was primarily things that came from lack of medical care, either due to fear of coming in or because things switched over to phone-based medicine. So I had one elderly lady who was treated, but from what she told me when she came into Emerge, she was treated for back pain over the last year with opioids, like so severe back pain, and she was just treated and seen by her doctor over the phone. But the pain became so bad that she had to call an ambulance and come in to see me. And so when I physically examined her for the first time in a year, right, because she hadn't seen a doctor, what she called back pain was actually a large tumor, a giant lump on her back. So I put an ultrasound on it, and she was riddled with metastatic cancer. And so that's somebody, it's hard to know when it would have been caught, but I can tell you for sure it would have been caught earlier if she got a physical exam. And maybe it would have been early enough that she could have been treated. But by the time I saw her, it was metastatic. And so that's something just so simple. Like if she could just go into her doctor and get a physical exam when she had her back pain, that could have been caught earlier. Another one, similar, again, I saw a lot of metastatic cancer cases, but yeah, another one was a middle-aged man who had belly pain for a few months. In his case, he didn't even try to go in because he was too afraid to come into the emergency room because he thought he would catch COVID, or we were overrun, which we weren't. Our hospitals were much slower during that time, not overrun. At least the ones I worked in multiple, but so he let the belly pain just go, and noticed his belly was getting bigger and bigger, and to the point that it got really tight and he couldn't really move it very well. And so that was when he decided, okay, well, now it's worth coming in. And when I checked him, and his belly was completely full of fluid, sent him for a CT, and it ended up being metastatic cancer. Again, if you weren't riddled with fear and lies really about the hospitals being overrun, and that, like, if he came into the hospital even during the height of COVID, there was so few cases, none actually in the areas where I work. There was zero risk of catching COVID in the emergency room. His life could have been saved, right? Because we could have caught that cancer early, possibly.
And not to mention, go ahead.
Yeah, so those were, so I mean, there's many, those are just examples, right? There's many more of people with a diabetic foot infection who didn't get seen in time and ended up with an amputation or getting septic. Like, so there's so many more of just they shut down doctors' offices and pretended like a physical exam is not essential, and really it is. Not a peep from the Ontario Medical Association, not a peep from the TV doctors who were clamoring for more lockdowns and for more restrictions. And so I felt compelled that somebody needs to say something, so they at least know, because there's so many people out there too who saw this in their own lives, but they're being while the TV doctors say we still need to shut down the hospitals and the doctors' clinics and all of these things, and there's no other side to the debate. So I felt like I needed to say something.
So now in regards to the ivermectin debate, like, that was a word that you couldn't say on social medias. You definitely couldn't put it on something like YouTube. What were your findings in regards to ivermectin and what it was able to do in regards to prevention of COVID, and then also just maybe the deterioration and relief from COVID symptoms and the virus itself?
Yeah, so I think there's multiple pieces to this. So I think part of the context is what is ivermectin? Ivermectin is a drug that has been around for decades. It's been used billions of times around the world. It's a very common drug. It's over the counter in almost all countries of the world, except for Western countries like Europe and North America. And it's used to treat mostly parasitic infections, such as like eye infections in Africa that causes river blindness, or worms of the intestinal tract or other things like that. So there's that. So what that, but the important point there is that it's a widely used drug. It's over the counter and it's extremely safe. So we know that it has extremely low side effects. Almost all of the side effects that are listed on it actually come from a reaction that happens when you are riddled with parasites. You have a bunch of parasites, you take ivermectin, the parasites die, and that causes a bunch of side effects. So almost all of the side effects that are even listed on there don't come from the drug itself, only from the breakdown of parasites if you have them. If you don't have parasites, almost all those side effects that are even listed there, like a bit of nausea, dizziness, things like that, which are very mild, you don't even get those. So it's very safe, has a well-established safety profile.